Hi, it's Emily, and I'm talking to you about CRPS. I said in one of my previous videos that I was going to talk to you about what it's like for me to get a nerve block. Um, I was going to take you along through the whole procedure, and then I decided that it probably wasn't appropriate for me to be filming inside the doctor's office for a couple of reasons. One, I didn't have permission from the doctor to actually film within his office suite. And the other thing was, it turned really nasty really quickly. I've had a lot of procedures on my back prior to the back surgery that I had, which caused the CRPS. Um, I have had everything from just nerve injections that are supposed to be for facets to what they call the nerve ablations, or I believe they're called RFAs. Um, and I've had everything, including just about everything under the sun. I don't think there's a procedure or an injection that they haven't tried. They've done trigger point injections in my back. They've done um, which are just injections all over your back in the muscles to try and get the muscles to relax. Those are usually lidocaine and um, sometimes Toradol to try and just get it to relax. Then the other injections can be just injections around the nerve to like a nerve block, but not really, so that they're more of an injection around it to just try and get that particular nerve to relax, like when they do an epidural. I've had lots and lots of epidurals. I've even had epidurals on the leg itself. That's how Dr. Nerezi and I started down this path together. Was I actually went in? He has a special urgent care just for pain patients, and I went into his urgent care crying, and he did an immediate epidural, and then a week later did a second epidural because the first one wasn't helping enough. Um, and so I've had epidurals with Dr. Nerezi, as a matter of fact. So he has been amazing in my care. But this nerve block, we did it, and you have to have an IV because the medication that they used can cause your blood pressure to crash. And one of the reasons that your blood pressure can crash is dehydration. And I am horrible about drinking water, so I'm thrilled that they did an IV because I would have crashed. Um, we pushed the whole, I think it wasn't a full liter, it was probably a half liter. So we pushed the whole half liter in. I was thrilled that we did that because I didn't crash blood pressure wise. But the pain from him doing the actual nerve block, I was an emotional mess. These Most of these injections, when doctors do them, including the RFAs that I have had done, I've had done with what they call no anesthetic or little anesthetic. You go in, you have, sometimes they'll give you an extra painkiller. Sometimes it's an extra painkiller and a Valium. Something like that, where they give you a little extra, but it's not like they put you to sleep. It's not like you get anything more than a local. And they just go in and they start digging around in your back. And we're going to poke at the nerve, and we're going to, it's intense, to say the least. Um, he kept asking me, does it still hurt? Does it still hurt? Does it still hurt? Till he couldn't give me any more local. And I was bawling on the table. And I've been through many procedures over the course of, now it's been 11 and a half years with my back. And that was intense. That was probably as intense as the RFAs ever were. And the RFAs are when they actually burn the nerves. And those were the worst I've ever had to go through. So that was horrible. Um, I wasn't prepared at all for that. I wish he had somehow prepared me for that kind of pain. I wish it had been more than just a local. It had been, hey, go ahead and take, an extra morphine or something, because I do have morphine for breakthroughs. I wish he had said, take a morphine for a breakthrough right before you come, because this might hurt a little more. Nope, nothing. Mm-mm. Um, as for did it help? Um, he did irritate the nerve a lot, and within 7 hours, I had a overstimulation seizure. Is the best way that we can assess that that's what they are. Um, I get really bad migraine, and then the migraine just doesn't really go away. Um, and I took my regular migraine medication that I take twice a day, but I didn't take extra medication to stop it, because it didn't seem like it was a horrific migraine. Like, there's a bad migraine, and then there's like the one where you're seeing auras and sound just kills you and light kills you. It wasn't that bad. So I wasn't prepared. I wasn't shaking. I wasn't cramping. All of the sudden, at about 10:30 at night, I woke up and I was restless. I was too hot. I don't know what I was. I was just all over the place. I could not sleep. And it wasn't that my head hurt, it was just like somebody set every nerve on fire, and they kept getting more and more intense. But it wasn't just in my left leg, which is the one that I would have thought would have been the one. It was like I was just agitated everywhere. So it was totally different than the way they had been presenting, and anything had been presenting. So I didn't automatically know, oh, go take the stuff that you've been taking for the seizures that's been helping so much. No, but alarm bells went off, until it was too late. And I had a seizure, about a 3-minute long seizure. Took the medication directly afterwards. Didn't have any more problems throughout the night. Didn't go to ER, because everything went as if it was a normal, everything going exactly like it's been going for the last several months. So until I get into neurology, which is still a few weeks away, we won't know more. Now, neurology may have to induce another seizure. That'll be fun before we know exactly what's going on. But that's a whole nother story. So as for the pain in the leg, it was supposed to, quote unquote, reset the amount of pain in my leg. Yes and no. The pain in my leg starts at my hip, or the pelvic bone where you sit. So if I sit on a hard surface, it it feels like it pinches a nerve, and it just zings down my leg. Um, that nerve was not as, that nerve kind of went to sleep. The nerve behind my knee has gone to sleep. The nerve in my ankle joint, which since day one of when I woke up after the surgery, when it has felt like somebody's been taking a Black & Decker drill and trying to drill up my ankle bone, that went to sleep. But the rest of my foot and the bottom of my foot, none of the nerve problems, the compression that you get, none of the burning or the pins and needles, the constant pins and needles, none of that has gone away. The cramping that I get, and my toes actually do this, especially my big toe and my index toe. So my first two toes do this, especially before a seizure. So the more active my toes are, excuse me, if my toes start to wiggle like that, it can be an indicator that I need to take a medication to stop the muscle cramps, which will help to stop a seizure. It's one of the two medications that I can take to help to stop the seizures, because if it can stop that, it lessens the amount of signals to the brain. If it lessens the signal to the brain, we stop the overstimulation, we can stop the seizure. I can't see that in the dark. I didn't know what was going on. It's under the covers. It's cold. It's November. I mean, we've got snow on the ground. So, we'll see. Was it a success? Not really. My back hurts more. My leg hurts a little less. I still can't walk because I have zero control over my ankle joint. And I don't have enough control, especially after 6 months of not being able to walk, of the musculature in the leg. I can, like here, I can show you. I can, without, that's my left leg. I can bend my knee. I can do all that. I still have control of pulling my knee up to my chest. So I can pick up my foot and put it back down. When I put it back down, I can't tell, is my foot flat on the ground? Or is it on the side? Is it, no clue. So even if I'm looking at it and I try to put it flat on the ground, when I put it flat on the ground, the ankle joint isn't stable enough to hold it. Now, would a walking boot help? Yes and no, because my ankle joint is frozen at a funky angle now, which may never move because of the way my CRPS has developed. I have advanced CRPS, and you would think, how can it be it's that advanced in 6 months? I woke up with advanced CRPS when I woke up with it out of the surgery. It was already bad, and it got really, really bad, really, really fast. It wasn't fully diagnosed until I did not get a diagnosis from a doctor who handed it to me and said, yes, this is 100% it, until somewhere between August and October, depending on which doctor. And nobody really wants to say, here, this is what it is, and here's, because my general practitioner said, I think this is what it is, but I'm not sure. And when the pain doctor finally said it, he didn't say it until October, handed me a pamphlet, says, here's what you can do, and there's like 3 things on it that you can do if it's not advanced. And one of which is neurostimulation, or is a stimulator unit, where you use a stimulator unit to stimulate the ankle so that you could stop feeling the pain in the ankle. Not going to work when the stimulation is causing the brain to have a seizure. So, yeah. Okay, so what does that leave us with? That left us with the nerve block, which he totally did not believe in. And the Mayo Clinic, which is the only place I was able to find any information on it, said that it wasn't really helpful in advanced cases. Okay, So he was probably pretty correct in saying we didn't really have much of a chance. All right, but we tried. We have to show the insurance that we've made an effort, because with insurance, they're going to say, did you follow through all of the procedures first? Did you jump through all the hoops? Yes, we tried a nerve block. Yes, so we've, and now we may have to prove to the insurance before we go to trying the only other procedure that can be tried as far as pain management is concerned, beyond long-term pills, or morphine pills, would be a pain pump. And I may have to prove from a neurological standpoint that the stimulator unit doesn't work. And so that's where I stand. If anybody ever has gone through this, or anybody has any other questions, let me know. My next video, or in a previous video, if you catch this somewhere and they're all jumbled up, I am going to go back out online. I found two sources that I want to get online and read more about. One is the Spiro Clinic and one is the Mayo Clinic, and see if I can't bring some more facts and things up and let you guys hear what my research has brought, as far as things that were precursors that I didn't know were precursors, things that I might be able to do that might help, that are alternate treatments besides just the pain clinic treatments, and basically where I'm gonna head from here is I'm just gonna keep forging through the pain clinic treatments, and I'm going to move forward with just trying to keep it as flexible as possible and as warm as possible, because it's cold, and when it gets cold it cramps, and keep moving forward. Hope y'all have a good day and happy Thanksgiving, because it's just about that time of year. Thanks for watching. Bye.